Good afternoon, everyone. A warm welcome to the SEAL webinar on the countdown from clean air for health, the countdown for the AAQD Transposition. My name is Anne Stauffer. I'm Deputy Director at HEAL, the Health and Environment Alliance. We're an alliance of over 70 member organizations working for better health through a healthy environment. And I'm also joined here by HEAL colleagues in this meeting. Today is Tuesday, the 23rd of June, 2026. In less than 6 months, actually, the EU member states will have to have transposed the revised EU Ambient Air Quality Directive into national law. The exact deadline is the 11th of December 2026, which is a Friday for the record. So this is why we are organizing this webinar here today, this exchange here today, as a health call for the swift and the full transposition and then also the implementation of the EU Ambient Air Quality Directive. For the revision which took place over the past years, a record number of health organizations were active, as everyone in our health community understood the urgency to act for clean air for health, as air pollution unfortunately continues to be the top environmental threat to people's health. HEAL and the many other health organizations that were active consider that the AAQD has significant potential to lessen people's suffering, to prevent disease, and to achieve economic savings. This revised directive is the milestone for public health. As we all know, and as we'll also hear more again in this meeting, this AAQD sets maximum concentrations of key air pollutants in ambient air across the European Union, aligning the EU's clean air standards more closely with what the World Health Organization recommends. These stricter clean air standards will apply as of the 1st of January 2030, and we'll hear more about this in detail, both from the EU level and then in selected member states on the state of transposition. But before we start, on this occasion also, since we're all, or many of us, sweating from the heat, I do want to mention the link to climate, as we are in the second heat wave of the summer already, and it's not even July yet. We know that people are suffering from the heat. They're unfortunately dying from the heat. And also air pollution and the burden from air pollution is going up, unfortunately. The science tells us that the combination of heat and air pollution unfortunately increases the risk of premature death for patients with heart and respiratory disease, especially in cities, as also unfortunately our cities don't cool down in the evening. This is another reason the current heat and air pollution link is another reason why we need the swift and the full transposition and the implementation of the AAQD. Because these strengthened clean air efforts will also support climate mitigation, they will strengthen the climate resilience, and they will also support reducing health inequalities, as we know that not everyone is equally suffering from the impacts of air pollution, unfortunately. Our distinguished speakers will now present a snapshot on transposition developments, also opportunities and challenges on the way to clean air for health. So the key questions for our exchange here today include: what is the transposition process and the timeline? Where are we currently in this process? How are the health voices being included or not in the transposition process? And last but not least, what are the next steps and how can we all get involved? One of us who cares for clean air for health, how can we contribute to making it a reality? Before we start, some housekeeping. This webinar is being recorded for everyone to watch then afterwards. We will publish it on the HEAL YouTube channel. If you have any questions and comments, and please do come in and join the conversation, use the Q&A function of this webinar. Unfortunately, it will not be possible to come in with your microphone and with your video, but we will certainly have a look at the Q&A and then see about your comments that we can hopefully then pick up at the end of this webinar. And indeed, our speakers and our agenda, I'm very pleased to have this distinguished set of speakers here this afternoon. We will first now hear from Wanda Yakir. She is team leader, air quality at DG Environment, the European Commission. And Wanda will provide us a snapshot, or refresh our mind, on the Ambient Air Quality Directive and the EU legal framework. Then we will have some snapshots on the transposition from Poland, from Germany, and from Spain. And I'll introduce the colleagues when we come to them. And last but not least, we will have time for your questions and your comments, hopefully. And with that, I want to open this webinar and give the floor to you, Wanda. Thank you so much for joining, and we look forward to hearing your presentation now.
Thank you. Good afternoon, everybody. And thanks a lot for the lovely introduction, as well as to Hill altogether for organizing this webinar, which I think is both timely and relevant as we are approaching the D-Day, so to say. So I'll just get straight on with the presentation that you should be able to see now. If somebody could confirm, that would
Yes,
be great.
wonderful. This all looks
Super.
fine. Yes.
Okay, great. So I will present to you the revised air quality directive, but more from the perspective of the impeding next steps and what are kind of its key elements that would need to be addressed in the first wave of implementation, so to say. So presenting you with some highlights from this directive, and maybe also sparking some discussion on how to come up with certain solutions. So we all know that this revised directive combines the two current or previous directives, as well as the 2015 amendment. And the member states now have less than 6 months to complete the transposition. And even though this directive is by and large following a very similar structure as its predecessors, it still means that there is work to do. I mean, this was a recast, so in that sense, there were provisions inherited from the previous legislation. But I'm guessing that in many member states, the approach is to rehaul the entire legislation, let's say, that they have at their disposal to address, to transpose the directive. In general, in substance, I don't think that I need to go very much into it, but basically, same as the predecessors, the directive sets out the requirements on how to assess air quality, on how to manage it, and they're putting forward specific air quality standards, how to address non-compliance with those standards or how to prevent them via plans and roadmaps, how to inform the public, and then there is also a chapter on implementing acts where the Commission has been tasked with providing technical details on a number of topics. Last but not least, we have the enforcement chapter, which is entirely new, and I think that also warrants a little visit during my presentation, as this is by and large entirely new in the legislation. So to first focus on not the assessment, but the air quality management, so the standards, I think we all know that the revised directive puts forward stricter 2030 air quality standards, namely as limit values, which is a big change compared to the previous situation. But I don't think that this warrants a lot of detail, because I'm sure everybody here is quite familiar with the biggest changes that have occurred here. I still wanted to flag that until 2030, we still do have what are commonly known as the current air quality standards, meaning that we are keeping the same levels as in the legislation right now, so in the 2008 or the 2004 directive. But if you would come with me to the lines with arsenic, cadmium, and benzo alpha pyrene, you will see that there is a very slight difference in the way that these standards are expressed. For example, for BAP, it's not 1 nanogram as of 2030, but 1.0 nanograms per cubic meter. And you might be thinking how this is just someone's pet peeve or something like this, but actually there is quite a consequence in this, because it means that when air quality is assessed and the assessment results are rounded to be compared with the air quality standards, this is done with the same number of digits as the air quality standard. So if for BAP, the standard is 1, which is the case until 2030, then if there was a result of 1.4, that's still one, and there is no air quality plan needed. But if, as of 2030, we have the standard that's 1.0, an assessment result of 1.4 would indeed mean that there is no compliance with this air quality standard and that a plan needs to be prepared. So seeing that, I'm guessing that a lot of people in this event are already quite familiar with the table. I thought it might be useful to flag this little difference that might actually have quite an impact in practice. And it was deliberately put in the proposal by the Commission, and thankfully it survived. We also have, of course, the short-term standards. So I was showing the annual ones, but we also have new standards coming in as of 2030 for a number of pollutants, including for those where we didn't have the same short-term standards like for PM2.5. We have it for the first time, a daily one. And this is still relevant because as of 2030, these standards need to be met, but they're still relevant today because air quality roadmaps need to be prepared, and I will come to this a bit later, in order to prevent an exceedance of the 2030 limit values. So it is important to keep in mind also the standards that are in bold in both of the tables, because even though they are to be met as of 2030, they shouldn't be seen as coming into force only in 2030. The moment to work on it is actually now, and that means that the moment for the member states to set up a system that can allow the achievement of these standards in the due time frame is also right now. So that's for the air quality standards. Now, moving on to assessing air quality, there is a bit of a change in the way that we will approach air quality monitoring and assessment in general. But first to say what is the same is that as levels are lower, there is a less rigorous, so to say, assessment of air quality, or with more uncertainty, whereas as the levels go up, there is more and more assessment required, which is quite proportionate. So in that sense, it is a positive thing. But what we see is that if the levels are above the limit or target values, then they should be supplemented by indicative measurements or modeling in order to have a better understanding of where how air pollution is distributed and on the potential hotspots. And this is only an option, an optional possibility for the authorities of the member states when the transposition deadline expires, so as of 11th of December, but it will become an obligation as from 9th of June 2028, and that is 2 years after the adoption of an implementing act that regulates exactly this matter, and I will come to this in the next slide. So right now, what is quite new is that we do have clarity on when this regime 1A, as it is called on the slide, but not in the directive, will fully kick in. And of course, there are then possibilities for reducing the number of sampling points, but there again, there still needs to be sufficient modeling or indicative measurements. And if we are below the assessment threshold, so below the levels from the air quality guidelines of the WHO, then even just modeling, indicative measurements, or objective estimation should be sufficient. And that is why it is in particular important that we have adopted the first out of 5 implementing decisions, and this one is the one of 9th of June, so 2026-1208, that provides technical details for modeling applications and indicative measurements, and namely how the results from these methods, so from modeling and from indicative measurements, should be taken into account for compliance assessment, both on its own, but also in comparison to the results that we have from fixed measurements. And so I don't think it makes sense that I go into great detail on this because the implementing decision is quite technical. but it's nevertheless relevant to mention. And another important detail that it provides is the methodology to determine the spatial representativeness areas of sampling points. So basically, for each air quality sampling point, the member states will have to provide information on the area that this sampling point is a representative of. And this is quite important and a big change compared to the current directive, because so far we don't really have such detailed information about what is what the monitoring network over the entire EU is representative of exactly. Even though currently the member states already have at least some rudimentary information about this, since they had to decide where to place sampling points in the first place. It's important to note here that even though the transposition deadline is in December this year, this decision will start applying on the 30th of June 2028. That means that it's only from that moment on that member states need to assess spatial representativeness following the methodology in this implementing decision. But what is important still is that there are public information obligations in the directive itself that apply, of course, already as of the 12th of December, when on the first day after the transposition deadline has expired. And that concerns the information, that also includes information on spatial representativeness areas of sampling points. That doesn't mean that we expect the member states to apply the implementing decision 1.5 years before they're supposed to, but it's true that information about sampling points should already, and what they're representative of in some form, should already be available to the public already in December, which I think is useful because I think this opens up the possibility for more public scrutiny, including at local or national level, as to where the sampling points are placed. Also having in mind, and I'll come to this, that there are enforcement provisions that would enable access to courts, including for these matters as well. The member states will also have to prepare air quality plans and roadmaps. And I think here the biggest difference between the two is that an air quality plan is prepared if there is already an exceedance. So the deadline has passed, there's already an exceedance. And right now, this will be mostly for the current air quality standards that we see are still exceeded in some parts of Europe, in some locations, even though with a far lesser magnitude than they were, for example, 10 or 20 years ago. On the other hand, the member states would also need to prepare air quality roadmaps if there is a chance that the 2030 standards would be exceeded in 2030. That means if in the period from 26 onwards, there is an exceedance of the levels are higher than the 2030 air quality standards. And that means that it is exactly this year in which we are now, that is the first relevant year for the establishment of these roadmaps. Of course, there is also, I will include this slide in total, which is kind of a useful memory aid. But basically, this slide here sets the timeline for air quality plans and roadmaps, at which point they need to be prepared and later on updated if they have not yield the results. And here it's important to say that they will need to be prepared 2 years, maximum 2 years after the exceedance. So if there is an exceedance in 2026, then it is by the end of 2028 that there needs to be a roadmap prepared for the 2030 air quality standards. So again, this is an element that is relevant already now or as of next year, so to say, when the local authorities, competent authorities, should be starting to prepare these things. You all know that there is also a possibility to postpone the deadlines. I will not go through the details of this. It is quite a busy slide as well, and I hope we can share the slides later. I was counting on that with the participants. But here again, just to say, it is by the end of 2028 that the member states should set up an air quality roadmap justifying a potential postponement. So in this sense, the obligations related to the air quality roadmaps and the 2 years deadline to establish them from 26, they match in Articles 18 and 19. But then again, it means that it is basically now that we should start thinking about the preparation of these. And coming to the last part of my presentation, I mentioned that there is a new chapter on enforcement, or rather a revamped chapter. It contains a penalties clause that was there before, but now in a more effective form, hopefully. But here I wanted to just flag that under the revised directive, we have a codified right to access to justice. It used to exist only based on the case law of the EU court, such as Janecek or Client Earth, and that established the right to access to justice in clean air matters. But we did see that in some member states, there was a struggle or issues with implementing that case law. So we do hope that with having this black on white in a directive, that this would help achieve a right to access to justice in all of the member states when it comes to cleaner matters. And I say this, it is relevant for transposition because this article also needs to be transposed like the rest of the directive. But I guess it will also depend on each member state where they choose to place that, because it might be that it's not, let's say, the Clean Air Act that is usually the choice, the vehicle of choice for transposition. So a single act focusing just on air quality, but it might also be coupled with or put in another piece of legislation of law that regulates in general public access to justice, including from NGOs. And here, what is interesting is to note that what this right includes is the right to challenge the decisions, acts, or omissions that relate to the location and number of sampling points. So, echoing what I was mentioning a few slides ago, air quality plans and air quality roadmaps and short-term action plans. So, we do hope that the transposition of this will also stay faithful to the case law and how it was interpreted by the court, and that it will indeed be fair, equitable, timely, and not prohibitively expensive for citizens and NGOs to be reaching the courts on these matters. And one last point on the enforcement is also that it is indeed as of the transposition date, same as for the access to justice, that the right to compensation will basically start to exist, because we know from the case law of the EU court for the current directive, so for the old directive, that there is no right to compensation under the 2008 directive if a person has suffered damage to health due to air pollution. But this is changing with the revised directive, and coupled with access to justice, it might be that we would also see further cases, more than we've seen so far, developing in national context. Here as well, it is, let's say, another kind of expertise, same as with the access to justice, that is needed to translate this into law. It is a little bit separate from the rest of the obligations and the air quality directive, so it might have a home in other law, but it is nevertheless to be transposed to form a uniform system with the rest of the directive. I did mention the implementing acts. One of them is already adopted, and there's 4 more coming by the end of the year. None of these need to be transposed per se. So there is no obligation from a legal perspective that the member states have to take these implementing decisions, is what they will be. and put them somehow in their legislation. These are basically the decisions of the Commission addressed to the member state. So no need to transpose, but there is a need to implement. So we do see, and I guess it will be similar in the future, that in many member states, the obligations coming from the implementing acts, and right now we only have the old act on the reporting, that they do provide some kind of legislative ground or regulatory ground for these obligations to be implemented by the relevant authorities. But as I said, from an EU law perspective, no obligation to transpose, but there is an obligation to implement. So it's for every member state to decide how best to do that. And lastly, kind of to wrap up all of the elements that I was mentioning, here you have a timeline that is focusing on some of the important, let's say, milestones in the coming years. As I said, 2026 is the first year that is relevant for air quality roadmaps, because this is the decisive year, first one that on which the obligation to prepare air quality roadmaps exists, and there is quite a lot of regular reproduction, let's say, from our side coming in terms of the other implementing acts this year. This also means that the monitoring requirements that I was mentioning, and of course they go beyond just that one slide with specific requirements on monitoring at super sites with many pollutants included, and monitoring pollutants of emerging concerns such as ultrafine particles or black carbon. All of these also kick in on the as of the 12th of December 2026, because it is as of that date that the old directives are repealed. So barring, let's say, the 2030 standards, everything else needs to be implemented already on that day. And then, of course, 2027 becomes the first year, full year, where we should have the air quality assessment done under the revised directive in full. So we will see what it yields, potentially already now the more use of modeling or indicative measurements and so forth. And the rest, I think it's quite clear. First roadmaps in 28, potentially seeking postponements in early 29, and hopefully 2030 is the year where we see the new air quality standards met, at least in some parts, if not in large parts of Europe, which is always what we should aspire for. So this brings me to my very last slide, which is just to say thank you, and I'm happy to engage further, respond to any questions or whatever you would like. Thank you.
Thank you very much, Wanda, for providing us this overview of some key provisions of this directive and of the timeline. Indeed, we clearly saw that there's a lot of homework on the side of the member states, but also on the side of the European Commission still. And also thank you for highlighting some ways where public scrutiny, where there are opportunities for public scrutiny. I think we could actually talk about that for longer because we also know that there are key new information requirements in this directive when it comes to informing the public about the health effects of air pollution or about air quality indices as well. So there's a lot to talk about, but we don't have time in this webinar. I briefly wanted to ask you, since we're talking about homework for the European Commission, if you could, yes, talk about the next steps from your side. So, on the 12th, as of the 12th of December, yes, when and how will you assess if member states have kept to the deadline?
Yes, thank you for that question. Indeed, very relevant. There is a centralized system in the Commission for monitoring whether the member states have, first of all, communicated the transposing measures. So if they have told us basically what they did. And I think in this centralized system, there is quite a fast mechanism where a letter of formal notice is almost immediately issued if there's not even been a communication of measures. So we will see basically on the 12th of December, we will see what the situation is. And then we will see if there is a need to follow up with some member states if they have not transposed or communicated to us the measures for transposition. But after that, further follow-up will depend on the situation. I mean, of course, if there is a lot of member states that have not even communicated the measures, the focus would be first on getting that information. But once we have information from all the member states as to what measures they have taken to transpose, so basically what are the laws that they use for transposition, then usually the Commission does a conformity check. So looking in detail in all the legislation if there is compliance with the legislative text. So just in the text, not looking at results of implementation. And then we follow up as needed. But this is a process that would take some time. I mean, we're not talking about months here, but maybe a couple of years. But it will depend first and foremost on how soon we get information from all the member states about which measures they use for transposition.
Thank you very much. So that's clear, a clear message to the member states. The Commission will be checking if you've done your homework, your transposition homework. Okay, thank you. And with that, we will now move on to hear from some selected member states on the state of play on transposition. And I'm pleased to give the floor first to my colleague Olga Wstowiczak from Poland, and she will give us the update on Poland and also how the health sector has been engaged in the AQD transposition.
Thank you so much, Anna. Let me just share my screen. Okay. I hope you can see everything.
Right, we can see it. Thank you.
Perfect. So I will talk briefly about the transposition in Poland and what is the current status. But before I dive in, I just want to give you a little bit of a background on why this directive is so important in the Polish context. Well, unfortunately, Poland is still one of the most polluted countries when it comes to air quality amongst European Union member states. And that means that it contributes to quite a lot of deaths based on the data of European Environment Agency. It could be up to 47,000 premature deaths annually. Unfortunately, still 80% of particulate matter and almost 90% of the benzoapyrin comes from household stoves. On top of that, there are really high costs related to air pollution. As counted by some researchers, it could be even up to 13% of GDP in 2014 to 2020. On the other hand, unfortunately, the past 2 years, so 2025 and 2024, we've seen deterioration of air quality in Poland. So the previous progress that's been made, unfortunately, is not like we're not seeing the progress that we've seen before anymore. And for us, implementing the air quality directive means saving lives. So the working group on the impact of air pollution on health at the Public Health Council, which is the Ministry of Health advisory body, calculated that implementation of the new air quality directive will allow Poland to avoid up to 30,000 premature deaths per year, thanks to the particulate matter reduction, and around 3.2 thousand premature deaths thanks to nitric dioxide reduction. So now that we know the background, I will talk briefly about the process of AQD transposition in Poland. So then we can see the status and where we're actually at and how much time and how long of a process is still, before us. So the first step is the Ministry of Climate and Environment that is responsible for preparing the draft act on implementation of the Air Quality Directive in Poland. And that is also being coordinated by the Government Legislative Center. Then the whole Council of Ministers needs to adopt this draft and then refer it to both the lower parliament chamber and the Senate. Then Sejm and Senate have to pass the law by 3 readings, and then the president signs, refers to the Constitutional Tribunal, or vetoes the act of air quality, of implementation of the air quality directive. Then this is published in the Journal of Laws, and Poland notifies European Commission about the transposition of the directive. So what is the current status of AQD transposition in Poland? Unfortunately, we're still at the very beginning stage of this process, which means that back in May 2026, there was a legislative project updated and published. That is a draft act on implementing the air quality directive. Unfortunately, the full draft of this act is not yet available to the public, as well as the public consultations timeline is also not clear. This draft also includes a planned date for adoption by the Council of Ministers. So let me go back to the previous slide. So the adoption by the Council of Ministers is the third point in the whole process. And this date of adoption is considered to happen in fourth quarter of 2026, which is very close to the 11th December 2026 transposition deadline. So what are the current concerns over the transposition process in Poland? First of all, of course, it's the compressed timeline for transposition. Unfortunately, before we've had issues in Poland with timely implementations and timely transpositions of directives, and internal processes and also internal concerns within the Council of Ministries is also plays role in the delay, possible delay. We also are very unclear about the process of public consultations and what is the timeline for this. We also now know that the financial cost of AQD implementation is somewhat a concern for the Council of Ministries. And the last part that we're also worried about is the presidential support for this act, and if the support of president or lack of the support may actually delay the transposition whatsoever. I've added screenshots from the European Environmental Bureau on a QD tracker, where you can also check how Poland figures also in comparison to other European countries. When it comes to health sector involvement in the implementation of in the transposition of air quality directive, actually last week on Monday, we have published during the press conference an appeal from health and science sectors that basically calls to strengthen efforts for clean air for health, including swift, timely, and full transposition and implementation of the Ambient Air Quality Directive. It's one of the widest calls that happened in Poland when it comes to the health and science sectors. Because we've had over 100 people and institutions also covered regional chambers of physicians and patients organizations. What are the demands of the appeal? First of all, as I already mentioned, is the full and timely transposition and implementation of the Ambient Air Quality Directive. And it's directly mentioned to be transposed by 11th December 2026. And that the implementation has to be full, including meeting the 2030 deadline without any derogations, to make sure that health of Polish people is protected. The appeal, the experts also call for adequate national and EU funding for clean air action, and inclusion of clean air considerations in an updated country's national health program, which is actually being prepared by Ministry of Health this year for 2027 and beyond. And that concludes my presentation. Thank you so much for listening.
Thank you, Olga, for this update from Poland. I should also mention that you're the Environmental Health Policy Specialist at HEAL in Poland. I think your presentation underlined very well the urgency to act and the need for the government and the authorities to really speed up on the transposition to ensure that it's timely and it's fully done. And indeed, thank you also for highlighting the AAQD transposition tracker, which has recently been launched from the colleagues from the European Environmental Bureau, which we all invite you to have a look at and see what the update is from your country. We are now turning to Germany, to the state of transposition there, and I'm pleased to welcome Dorothea Baltrux here with us. She's the director of the Center for Planetary Health Policy, and she will now update us on the situation in Germany.
Thank you so much. And let me just also share my screen. Okay, I hope you can see that now in full screen.
Yes, wonderful.
Yes.
It works.
Okay, brilliant. Yes, thank you so much for inviting me to this webinar. I'm really glad that we can talk about the AAQD transposition. And obviously, we've been working with HEAL on this topic for some years, and so really appreciate this opportunity. And just to explain who we are, the Center for Planetary Health Policy is a think tank, and we're part of an NGO, the German Alliance on Climate Change and Health, which does similar work to HEAL, but on a national level here in Germany. So we're focusing on lots of different topics related to planetary health, and obviously air pollution is one of them. So, yes, transposition in Germany. Let me start with what our context is for the implementation. So I think one of the things we struggle with in some ways is the fragmented responsibilities in Germany. We are obviously a federalized country, which means that on many different policy issues, the federal level actually doesn't have the main responsibility and not the main say, but it's the states, the 16 states that really bear most of the responsibility. And air pollution is one of those issues. So whilst the federal level is responsible for transposing the AAQD international law, it's really up to the states, and then in some cases also the municipalities or kind of a regional institution in between to then implement the AAQD and really follow through with it. And that creates a lot of problems. First of all, it's the financial limitations of many municipalities. This is the big topic in Germany right now. Most of our municipalities really are in great financial difficulties, to the point that really a lot of them struggle to do anything beyond their kind of statutory tasks. And sadly, the municipalities that are most challenged by air pollution and also other things that are connected to it, for example, high poverty rates and other environmental injustices, are often the ones that are also most challenged in terms of financial limitations. So this is quite a big problem. And sometimes it's simply whether they have the resources to actually engage with this topic at this moment. And then the other challenge that we've been facing is that it's primarily the responsibility of the environmental agencies and environmental ministries. So health agencies are not very involved, neither in transposition nor in the development of the measures at this point. We see the main opportunity and also the main thing where they should be more involved, especially in communication also of the measures, but I will come to that a bit later. And the main point I want to start with, and I'll come back to that again and again, is the effective air quality governance in Germany, but I'm sure this also is the same in many other countries, really requires measures at all levels of governance. So we need the EU level measures, we need federal, state, the state level and the municipal level action beyond just transposing the AAQD. It really has to kind of address all the measures that will actually bring down air pollution as well. So where are we with air pollution? I just wanted to show you PM 2.5, which is obviously the one that is probably most concerning for us in terms of health impacts. And these three maps show you projections by the Umweltbundesamt, so our Federal Environment Agency. And on the left side, where everything is green, you can see the current, so the old limit values, where pretty much all of Germany is within those limits. In the middle, you can see the new limit values up from 2030, and you can see that some areas will have difficulties or will not meet these new limit values. And then on the right side is the WHO limit values, which is a whole nother story, obviously. And I think it's always important to mention that we will still, pretty much all of the country will breathe unhealthy air from a WHO definition, even if we reach the new limit values. So that just gives you a kind of sense where we are. Germany is definitely able to meet the new limit values for most of the air pollutants, but there will be some hotspots, you could say, or some areas where there will be a challenge. So where are we with the transposition of the AAQD? So actually the draft of the Bundesemissionsschutzverordnung, so basically the federal law that governs emissions, has been published a couple of weeks ago, and there was a very short period as well for NGOs to comment on, which we did. And as we expected, it's pretty much a one-to-one transposition of the AAQD, absolutely no surprises. A few things that we don't really understand. For example, the federal government is planning to put this into place from the 1st of January 2027, so 2 weeks after the deadline, and we can't really see a reason why. It's only 2 weeks, it's Christmas, but yeah, so there are a few details where we see some concerns. In terms of the contents, I think one of the main things that we and others have criticized is that shipping and harbors could be pretty much excluded from the measures, which would be detrimental in cities like Hamburg, for example, where the harbor really has a big impact. And then the other thing for us was the definition of household heating, because in Germany, wood burning ovens tend to be just a secondary heating source. It's more of a luxury product. It's not the main source of heating for most places that have this. So that would need to be clarified so that it would not just be generally excluded. And then ozone is a big deal for us, because ozone is the only, the only big air pollutant where Germany hasn't seen progress in the last few decades. So in all of the other air pollutants, air pollution really has gone down significantly in the last few decades. But with ozone, since 1995, it stayed pretty much the same. And especially in traffic near areas, it has actually increased as well. And if you know anything about ozone, it's almost impossible to reduce at the municipal or the local level. This really requires federal planning and the federal responsibility. Austria has that, and we definitely think that Germany should follow this example, because otherwise municipalities will not bring this down. And because in the AAQD, this is only a target but not limit value, we are very concerned that ozone will just not be addressed adequately. And the main thing for us, again, and this is also what we mentioned, is for the federal government, we have the impression that what they think is, well, we've transposed the AAQD now, and that's our job done, and that's definitely not enough. Also, the federal level has to allow and enable municipalities and states to actually implement the necessary measures, let it be in transport or heating. There are lots of limitations where municipalities are not able to implement these measures because there are limitations of the laws at federal level. And just very shortly, what we're actually working on. So we've been working on the AAQD for a few years now with funding from the Clean Air Fund. And right now we're focusing on the implementation in 2 areas in Germany that are particularly challenged, Berlin and the Ruhr area. We've had a number of workshops there with stakeholders sort of from the municipal and state level administration, from health institutions and traffic. And yeah, we are putting kind of the findings now in a policy brief, and then also we'll discuss that with kind of federal policymakers. And then there was a sister project as well. They've done some modeling on 2 cities in the Ruhr area to see with which measures they would actually be able to meet the 2030 deadline. And surprise, surprise, I can already say that it will be difficult for them in some cases to meet the new limit values just with local measures. It will probably not be possible. There will need to be some federal action. Otherwise, yeah, it's going to be not really possible. So, sorry, I'm realizing I'm short of time. So just a few sentences on the challenges for implementation. There are definitely some challenges of reaching the new limit values, especially with traffic and PM 2.5 and NO2. I think those are the ones that we're concerned about. As I already mentioned, there will be stronger action required, and transport is really the sector that we're most worried about, I think, because it's the same with climate action. The transport sector hasn't really made a lot of progress, or no progress at all, and it's probably the issue that is also most polarized and where it's very difficult to kind of make any kind of substantial changes that would really bring down pollution at the moment. And as we all know, even with electric vehicles, we won't completely get rid of the problem because of tire wear and tire wear is the main problem there. This is more about transport. So as I was mentioning, we would need some national measures actually to reduce the transport issue. And then one other example, for example, that the local administrations can't do at the moment is introduce low or zero emission zones. This is something that would have to actually be changed in the national legislation. And again, my main message is the federal level needs to do more than just transposition of the AAQD, and we really need to look at all of these different areas where transposition or where the measures will be introduced. One positive sign, maybe to end on a positive note, is that we're seeing this considered in an update now of our building law. So in the building legislation, actually air pollution will now be included, and the new measures are taken into consideration. So this is a really great example of how this could work also in other sectors. Thank you.
Thank you very much, Dorothea, for this overview on Germany, which you highlighted very well the need for all the different governance levels to work together. But I would add there also the need to work together with health civil society actors, and also, as you say, health should really have a place at the table when the transposition implementation action is taking place. We are now moving on to Spain, and I'm pleased to welcome Adrián Alonso Ruiz. He's the Research and Advocacy Manager at Salud por Derecho. You'll give us the update from Spain, and Adrián will go slightly over, so that's totally fine. You can give your presentation as you had planned, and then we will record it and then end the meeting. So the floor is yours.
Thank you very much, and thank you everyone for spending some time with us today. Thank you to all the panelists for the very interesting presentations, and actually you've made me feel much better about the status of the transposition of the directive. At least I'm feeling less alone as a Spaniard now. My name is Adrián Alonso Ruiz. I'm a Research and Advocacy Manager at Salud por Derecho, and we've been working on the AAQD transposition for the implementation and transposition for a few years now. As you know, in Spain, as you might know, in Spain, the transposition is taken by the Vice President and then the Minister of Ecological Transition and Demographic Challenge. Sarah Agesen, who is or was the right hand of Teresa Rivera when she was the Vice President. They have, at least in our experience, they have been a bit opaque to participation from civil society, and it's very hard to reach, at least at the political level. When it comes to the technical levels of the ministry, we know for a fact that there's a team which is very involved and really taking care of, including civil society, patient groups, and environmental and health associations into account when dealing with the transposition of the directive. So both good and bad things about this file being taken care of this ministry. Where are we currently in the process? So Spain has taken a two-line approach. First, they have a project of royal decree on improvement to ambient air quality. And I'm going to be using project a lot, and that tells you a lot about the status of the transposition of the directive. A royal decree in Spain is a lower norm or rule in the hierarchy, in the legal hierarchy in Spain. It does not require parliamentary approval. It gets approved in the Council of Ministers. And in the case of the AAQD, it transposes the technical article. So basically 99% of the directive gets transposed through this act. The status at the moment, it came out of for public opinion in early 2026, if I'm not mistaken. So there was a period of, I think, 2 to 3 weeks for public opinion where civil society, all patient groups, everyone interested could submit an opinion. After that, it comes the ministerial review and redraft of the proposal, which is the stage that we are on at the moment, and the consultation to the autonomous regions. Similar to Germany, Spain is a very decentralized country, and in a process, in a legislation that deals with a lot of regional implementation, the government is required to consult with the regions to ensure that the transposition it's appropriate. After this, the act gets sent to the Council of State, which is a consultative body in Spain that doesn't have usually a veto capacity, but they can issue a recommendation to redraft the act on certain aspects, mostly if it entails certain changes to constitutional, to issues that can be linked to constitutional non-compliance. And after the Council of State gets the act approved, it gets approved by the Council of Ministers, and then it gets published. So we are more or less halfway, not too bad. The other part that transposes the directive in Spain is the pre-project, the law pre-project of reform of the ambient air quality law, and it's a pre-project, so it's not even a project at the moment. It transposes the articles that relate to access to justice, and it does require parliamentary approval. So this has a rank of law, and therefore it requires parliamentary approval. The stage we're in with this law is that we are the draft has been published, and it actually closes the public opinion space in 3 days on the 26th. So everyone is welcome to provide input to the draft. After this, the process is slightly longer than the royal decree. It requires ministerial review and redrafting, and internal consultation with the legal services of the ministry, reporting to the Council of State, approval at the Council of Ministers. So at this stage, it's no longer a pre-project, it's a law project that gets sent to the Senate and the Congress. It needs to be approved by both chambers, or at least the Congress 2 times, and then it gets approved and published. So a very long process, and it's barely starting now. And considering the transposition delays that we usually fall in Spain, we are among the most non-compliant countries in member states in Europe. I'm I'm very skeptic about the capacity to be on time for the Spanish government. Some barriers that come out of this legal process. First, the limited capacity at the Ministry of Ecological Transition. So there are several acts that are being drafted at the moment, and the legal services might be overwhelmed, and the technical personnel at the ministry might be also overwhelmed. The consultation with the autonomous regions, it can be a challenge, especially because we are in a very polarized political environment at the moment, and most of the regions are governed by the right-wing Popular Party rather than the left-wing Socialist Party that is controlling the central government, and that can create tensions and pushbacks from the regions. Timelines at the Council of State can be very slow, so it can take a few months, a couple of months maybe, for the Council of State to come back with the decision. So things can be slowed down quite significantly. With the reform of the air quality law, we have the same three challenges, but at the same time, we have an extremely fragile government. The government is facing corruption scandals with the very close circle of confidence of the president. And there are some rumors that we might be having snap elections at the beginning of 2027. And at the parliamentary level, there's a minority of the government. And just this year, only 2 laws have been passed, which is almost nothing. Just to give you an example, we are still using the budget from 2023 because the government hasn't been able to approve a new budget. They just cannot come up with a majority in the parliament. So my assessment is that we're not going to be in time by the end of the year. And as with many other directives, we'll be facing fines for not being compliant with the timelines. I'll be very brief. Next steps and key messages. With a very decentralized country, most of the technical frameworks permeate to the local and regional level. So advocacy needs to go to these levels, basically through the promotion of active mobility, the protection and promotion of low emission zones, and the promotion of public transport measures over just electrification measures. Not just because this is what leads us to being compliant to the new directive, but just because it's also more just, more sustainable, environmentally speaking, and also healthier. We have been working to have the ministry include public information referencing WHO levels in their databases, not just the legal ones from the directive, but just to reference WHO. And mention the health consequences of chronic exposition to pollution, which at the moment only reflects acute exposition levels and doesn't reflect the real burden of disease that causes pollution in people's health. And we're currently working to create networks of health and patient organizations. We're liaising with neighbors associations, which are grassroots organizations very powerful in Spain. And hopefully in the future, we get to contact working unions to create a more solid coalition of people interested in implementing this in a just way, in a fair and equitable way. The current process, and this is something that we're looking closely, is the transposition of the access to justice articles. And we're very concerned that Article 28, which is at the moment missing in the law pre-project, is not being transposed, just because the ministry says that the current legal framework is good enough. We disagree. There's nothing in the current law that is designed and applied in such a way that doesn't render an impossible or excessively difficult exercise of the right to compensation, which is what the directive says at the moment. So we will be looking at this in the next few months. I think I'm going to stop here just because I was going to do a bit of self-promotion, but I can share the report on the chat and finish earlier. Thank you very much, and look forward to the questions if there's any.
Wonderful. Thank you very much, Adrian, for this overview on how the transposition is taking place in Spain, for highlighting also if you want, the commonalities with other countries, but also differences. I think what became very clear from your presentation is indeed this ongoing need for the health sector, for everyone concerned about clean air for health to be engaged, holding decision makers accountable. And so this is also the invitation to everyone listening today, to other participants or people interested from the health sector, to contact HEAL and let us know how the state of transposition is going in other countries, and see how we can work together to ensure the full and the timely transposition and implementation. And one last comment from my side, if you allow me, something that we didn't have time to go into detail today, but become also very clear as member states are doing their homework on the AQD. Financing and public financing for the implementation is a key consideration in all of this, and I want to flag that currently the next EU budget is being negotiated, and from our perspective, from his perspective, but also from many others, it is key that this next EU budget cycle foresees actually financing for the AQD implementation for Clean Air for Health measures. And so again, this is an invitation for all of you to become active on this, because this public financing from the EU side is then also key to unlock further financing from the national level. And with that, we have to close the exchange for today, but it's certainly not the end of the conversation. As I said, please do contact us. Let's stay in touch. Let's continue to have these exchanges on the AQD transposition implementation. I would like to thank very much our speakers here this afternoon for your excellent presentations, which were provided for a really, really good overview. This is also something that he will be further working on as we're preparing a briefing on the state of transposition and health concerns for the second half of this year. I would like to thank our participants, all of you listening in and showing your interest. And last but not least, I would like to thank the HEAL team in the preparation and the support for this for doing this event. So very much my HEAL colleagues. Thank you, Sophie. Thank you, Elke. Thank you, Olga. Thank you, Natasha, for this exchange. And with that, I want to close this webinar. As I said, the recording will be available. We'll also share the slides. And I wish you all a good rest of the day in a cool place with lots of water.